Good afternoon. We're excited so much about our tower expansion, and you can see that we're right here in our new area to where our ambulances are going to actually come through and park to get access to our ED. This tower project is 7 floors, and we're going to go through each of those floors, the first floor being the ED. One of the things we love about this expansion and this remodel is that we have 3 dedicated trauma rooms. And you can see they're right behind here. They're private rooms. We have these sliding glass doors. Let's walk in here, and I'm going to ask Kathy to kind of tell us a little bit about these trauma rooms.
So these trauma rooms are larger than our current trauma rooms in our old emergency department. They have additional space for staff to be out of the way, but they can actually document what's occurring, which includes which members of the trauma team have arrived and what things are being done for the patient.
We're about 10 feet away from a trauma bay unit right now, and we have access, the emergency room staff, the physicians and staff have access to the CT scanner right within the emergency department. We're right here on the 2nd floor, and some of what we're doing on the 2nd floor is adding a few more offices, but the most exciting thing about it is we're adding, expanding our dining room services. So we're actually going to have individual food bars, so we're really excited about the expansion here on the 2nd floor. Most excited for our staff as well as our visitors. All right, we're actually on the 3rd floor now, and I'm here up where we're going to expand surgical services. We're actually adding 3 additional surgery bays to this floor. We're also looking to expand the rooms, and actually I'm up here with Ian Ray. He's a Director of Surgical Services, and you can kind of see we have a nice little glow going about us because there's no air conditioning up here. And you'll realize real quick that Ian is not from Texas. So I'm going to let him take it over from here and kind of show us around. We're real excited about this area.
This suite alone is for trauma. That would be general trauma procedures. Anything that we can get coming in requires a general surgeon. And this room here is a specific hybrid surgical room, the only one in West Texas and the only one in our area. This area here, if you want to come in, will allow us to do very specific catheterizations of hearts, heart procedures, and very specific neuro procedures. But the other aspect of trauma care is neuro injuries, spines and heads. To deal with that, we've built a further 2 larger rooms, both of which will be used for trauma, which is specifically designed with neuro in mind to allow us to do spine surgery, brain surgery, craniotomies, etc.
So we're moving our cath lab services from the 3rd floor to the 4th floor, and we're standing right here in basically the waiting room for what is going to be the waiting room for the cath lab. And I'll let David walk us through the rest of the cath lab because we have 3 cath lab bays, so we're set up for expansion. So David, take us through that.
This will be one of the stress echo labs that we'll have here now. It will be connected to the cath lab to keep cardiology services all in one place. Another new change we're excited about is our holding areas. We will have 7-bed holding area here, and they'll be individual with walls separating the patients. So there'll be private prep and hold areas and recovery areas. Well, thanks for following me. This is one of our cath labs. I said we'll have 3 now. They're all much larger than we are used to, than we've had in the past. As you can see, it's not very finished. As you can see, you can be positioned in this room and see what's going on in 2 separate cases. You know, I mean, there'll be dedicated personnel working on each case, but there's always backup if you need it, looking into the other room.
Our 5th floor and our 6th floor looks like this right now. This is basically where we're going to add additional acute care beds. Basically 15 beds, additional beds on this floor, and 15 on the 6th floor. So we're really excited because during many times during the year we get in points where we just don't have enough beds here at Shannon. So this is really going to expand our access. So we're real excited about this.
So as he said, there's 15 rooms on this unit. They are wrapped around 1 central nurses station that has all the appropriate. We have a dirty utility room and a clean utility room, and that's centrally located. So the rooms are actually in a square around a central nurses station. So come this way. Every single room has a window with a great view. We're talking about we're on the 5th floor of the Shannon Tower. So if you look to the back wall where it looks like there's a piece of paper up there, that is actually our pneumatic tube system. The same one we saw in the emergency department. It carries through the entire tower. and would carry specimens to our central lab. So this is a mock-up of what a patient room will look like on the 5th and 6th floor. As we show you around the room, you're going to see pieces of cardboard on the wall with words on it that say what's going to be in that space. Everything has been exactly measured. We've had nursing involvement in deciding where things were going to be located.
Well, we're back down here on the 1st floor. This project actually is 7 floors. Tell us a little bit about the 7th floor.
Sure. The 7th floor is where all the mechanical equipment goes for this new tower and actually some of the existing buildings. So we didn't go up there because it's all mechanical type equipment and there's a lot of work going on right now.
From start to finish, how long is this project taking?
It will probably take us about 3 years. We started in January 2016 and we will finish around October 2019.
So really one of the biggest projects we've ever done here at Shannon. We're real excited. Dale's done a great job with this project. Special thanks to him, and also I want to say special thanks to Lindy Stone, who's our Director of Marketing, who helped put this event on today. I also would like to thank Kathy Powell, Ian Ray, and David Harris, who helped us kind of tour this tower expansion. Thank you for having us.